All right, y'all. What we're going to talk about today, social determinants of health. This is going to be a really quick overview of SDOH. We're going to talk about CHAWS and CHIPs and root causes, why blue zones, funding and focus areas, the vision for Sevier County, and then you'll get to hear from them. All right, social determinants of health. Who has heard SDOH? Okay, very good. This is something that should be drilled in by now. I like to share this slide at the very beginning because this is really foundational to what we're doing with blue zones. Social determinants of health, or SDOH, I'm going to use some acronyms. These are the conditions and the environments where people are born, live, work, play, worship, and age that affect a wider range of health, functioning, and quality of life outcomes. These SDOHs are broken up into 5 domains, and you've got education, quality, access to quality health care, our built environment neighborhoods, our social and community context, and economic stability. SDOH is so important to our health because, as was shared with blue zones and as Dr. Mabry discussed, our SDOHs contribute to 80% of our health outcomes, whereas genetics is about 10 to 20%. 80% of our chronic conditions come from these SDOHs and our health outcomes. Very important. That is your SDOH lesson. Take that with you. All right, let's talk about community health needs assessment. I'm going to call this a CHAW because I don't want to say that over and over again. How many of you participated in a CHAW? Okay, healthcare, hospitals definitely have. All right, what a CHAW is, this is basically a tool that we use in health to identify what are the needs in our community as it pertains to health. In communities throughout Tennessee, this is done every 3 years, and in communities where there's a nonprofit hospital, that hospital leads the CHAW process. In communities where there is not a nonprofit hospital, it is the health department and the Community Health Improvement Council that leads this process. We completed our CHAW, and you can see LeConte Hospital's here. You can see our CHAW. We completed this last one in 2023, and when you do the CHAW, you do a variety of strategies to collect data and figure out what's going on and what your needs are. And what we identified were the top 5 leading causes of death in Sevier County. Heart disease leading the way, not surprising and not probably different in your community. These might change order, but this is pretty typical. That was what the data showed us. In our CHAW process, you have to engage the community as well. And we got out to the community, we surveyed them, and these are the top 11 most severe problems in Sevier County identified in our needs assessment. You can see lack of affordable housing, adult obesity, heart disease, stroke, cardiovascular disease. You can see you'll find these on your CHAWs as well. Every time I showed this presentation or I talked to people about our community health needs assessment, I usually got questions about why workforce was on here and housing was on here, because that's not a health problem, but knowing SDOHs, that is a health problem. Now, with community health CHAWs, there's a companion. And this is called a CHIP, a Community Health Improvement Plan. And what this is a written plan or strategy to address your health needs in that given community. Our CHIP is led by our local nonprofit hospital, but there's other CHIPs that are out there by the Health Council and other agencies. And I was curious when I was reading our CHIP, I wanted to know what was going on across Tennessee and across the nation. So I looked for a study to find these CHIPs and how they were addressing SDOHs. And a recent study, this just came out, looked at 80 different CHIPs from across the U.S. And what they found was that nearly 90% of CHIPs address healthcare access. 90%, that's one of those 5 domains of SDOHs, where nearly 2/3 address food insecurity, neighborhood infrastructure, or affordable housing, and less than 1/3 address education access, economic stability, or safe housing. Knowing that these CHIPs and CHAWs are led by hospital systems and healthcare, you can see where access really dominates our CHIPs. You know, if you lead a company or do healthcare, you're going to pick a strategy that you have resources to allocate to that. You're going to fold it into your plan because it makes sense and you have control over that. And the feasibility of doing it. You can increase your services or increase your hours or increase your staff. You have a lot more control over that. But what about these other SDOHs that are contributing to our health outcomes, and who's working on those? Another really cool aspect of doing your CHAWs and CHIPs is you get to see who's doing what and where are the gaps. This list is not meant for you to read and see and memorize. It's to highlight Sevier County and we have a lot of resources. We are a very resource-dense community, and we're very fortunate to have that. We're considered a rural community, a rural county in Tennessee, and you don't see this list in other rural counties in Tennessee. So we're very lucky. Sevier does a really good job. If you see a problem or a gap, they're really good at coming up with the resources. So you would think that based on our CHAWS and our CHIPS and our strategies and all the resources that we're putting into this, that we would be seeing some pretty good health improvements. But that's not the case in Sevier County. I'm not going to act like I'm an epidemiologist or somebody who's really driven to look at data all day long, but this is important because when you're a chief health strategist and you're trying to figure out how do I make people live happy, healthier lives and thrive in my community, you've got to know what direction you're going in. You've got to know the projection that you're going in. So this is a Sevier County comparison measure. I pulled the measures that were relevant to this summit. So as you can see, life expectancy, tobacco, obesity, our food environment, access to exercise opportunities, excessive drinking, and mental distress from 2019 to 2024. All our resources, all our strategies, we're not going in the right direction. Data is lagging, I understand that, but we're actually going in the opposite direction. And then I didn't do a projection of where we were going in the next 5, 10, 15 years, what this looks like for us. But if you look at adult obesity, 40%, that's 40,000 people in Sevier County who have a BMI of 30 or higher. This is not just a health problem. If we want to talk about money with that, that's over $74 million a year in additional health care costs for that one measure. So that's going to keep increasing if we don't stop and turn around the direction that we're going in. You can also see Tennessee and U.S. statistics, but the whole point of this slide is to say, all right, if I look at my job and I show this to my boss and it shows that I'm not actually improving, what really happens? And then I'm curious and I want to know, but why is this happening? And this is root cause mapping. It's probably a tool that you've used in your own business. This is a fishbone diagram, the Ishikawa diagram. And what you do when you want to know what the root cause is, you start with the problem and you work backwards. So for this example, I picked heart disease. The light green boxes where you see stress, obesity, high blood pressure, unhealthy diet, those are just some of the factors that contribute to heart disease. But then you have to peel back the layers a little bit further. And what is causing the stress? What is causing the obesity? What's causing people to have these high blood pressure rates that's uncontrolled or unmonitored? And what's contributing to these unhealthy diets? Those that you see up there are the SDOHs. That is the root cause. So if I want to see improvements in my county and for the state of Tennessee when it comes to chronic conditions, I need to put more into this, and I need more partners to help me with this. So how do we turn our social determinants of health into social drivers of well-being? Before you answer that question, what does that even look like? It could be very objective and different for me than what it looks like for you. But for Sevier County, this is my wish list, and this is a holistic approach to achieve total health and well-being. This is what we want. This is what we want to see, and we want to make sure that we're building these healthy environments. It's sustainable. We're aging in place. We're staying at home as we get older. And we want to include arts and culture in the work that we do. We're very proud of our heritage. I am not from here, I'll say that. I'm a transplant, but very much I feel like I've been adopted into this community. But how do we build on the things that are important to us in our culture so that we can build on that and not take away from what's important? But how do we achieve optimal health and well-being? So enters blue zones. On this slide, it's going to look like I have a favorite child, and I do not. I have 2 kids, and he just happened to be in the pictures of these. But why blue zones? When you think about blue zones and what Danny presented, these are the pockets across the globe where people are living longer, healthier lives. They're aging in place. They have lower rates of chronic conditions than anywhere else that than the United States. And it's built on their natural and cultural resources. They don't bring in different industries, and they don't bring in different hospitals and Whole Foods and fitness centers. People in these blue zones move naturally because their environment is conducive for them to do so. The garden, that's my son's garden. He wanted his garden, and he actually has a bicycle helmet on in that picture, which I don't remember why, but that is his garden. They garden, and that's a good form of physical activity or movement. I love hearing that. You call it movement, not exercise. And they have a sense of purpose, social connections. they know how to chill out, and we're the worst at chilling out. We can practice all these stress management techniques, but we've got to do better. We got to do better at that. And also, this is the last picture that you see of people praying. There's a spirituality component to this, and that's not something that's always included when you talk about improving your health. You hear over and over again, exercise and nutrition, exercise and nutrition, exercise and nutrition. But what role does spirituality have in that? You've heard. And then again, the social connection piece. Where are these places that people can gather and socialize and practice some of these? And Lawrence, who's here, he came up with this concept. There's something in the South that we do. It's called front porch sitting. And how do we do this on the front porch, where we can gather people together, we can hang out, we can play music? What does that look like? And we've really have done a bad job at engineering that out of our culture, even though it's very much fundamental to what we do and believe. Oh, the last thing, it's Public Health 101. I'm a public health person. It's just who I am. And this Power 9 and these concepts are Public Health 101. We know that this works, but we are not doing a very good job at getting other people to see how this works and what we can do to make it work. So that's blue zones when you're thinking about how do I do this in my community and make my community healthier and change the direction we're going in. The blue zones, you've heard the evaluation piece. Again, this is light. I knew that Vicki was going to come through in the storyboards when it came to data, so I'm glad you brought those. But the evaluation piece, it's not enough just to measure our successes by the number of people who come to an event, the number of health fairs that we have, the number of clicks to a website, the QR code scanned, the number of resources I handed out. You have to evaluate and measure the so what. So what? I did this. And I ask people, I said, so what? Tell me what you did. What was the impact of that? For us in Sevier County and for me, the evaluation piece and getting the data in real time and not waiting 3 to 5 years to see if what I did 5 years ago had an impact. With the blue zones, you get that evaluation every 6 months. So if we're doing something that's working, we can tell in real time, and we're not waiting to say, oh, well, that didn't work. Let's find the next evidence-based program and do it again. And I am in this for the health, but it's not realistic to think that health and the economy do not go hand in hand. They absolutely do. You've got to see a return on investment. I can't ask people to help fund this project. I can't ask people or businesses to say, hey, you need to invest in your people unless they see a return on investment. And Alan, he's our economic development, and he's been very nice to guide me through this. And what I've learned, and I knew this to some extent, was that if it doesn't make money or save money, it's really hard to sell. So, and that is the case. So how do you show your return on investment? Blue zones can do that. Another aspect of blue zones that was so appealing to us to start this in Sevier County is they work with community partners in a strategic way. Public health, we work with partners because of the population they serve. They reach a population that we can't reach. We're going to partner with them, and we're going to give them our resources and educate them and tell them what they could be doing to be healthier. But Blue Zones goes in and makes these environmental changes, very strategic way and very, very impactful with these places that we may or may not have been successful with in forming these partnerships. And then lastly, why Blue Zones? We need a dedicated space to do this work. If you work in a hospital, public health, healthcare, I don't care what business you're in, you've got to prioritize what your business needs are, what your budget is, what your resources are. And that's not going to be enough to do this work. We've got to have a space where we can do this work, focus on those additional SDOHs, but not by ourselves. We've got to do it in a collaborative way where we pull in all of our partners and we pull in all the people who can do this work together and work in a collective way to have an impact. And the last thing I'll say about Blue Zones, and it's not about duplication, but elevation. I hear this all the time in public health. I step on toes, I think, when I talk about, hey, do Blue Zones. They do really good work in public health. I don't know if it's a territorial thing or what, but they say, oh, well, we do that. We do that. You've seen in Sevier County, we do that. We have all kinds of resources to do that work. It's not about duplication. It's not about taking away, but how do we elevate what you're doing to where it's more impactful? What's the so what of what you're doing? Sevier County, so if you want to do a Blue Zones project in your community, it's going to look different than what it does in Sevier. We're going to have a different plan than what you have and a different strategy. We started this conversation actually in March of 2023, and it came back around in January for our stakeholder meeting. Dr. Alvarado, who you'll see tomorrow, He came to the meeting virtually, and you'll see who was in attendance, but we talked about the CHA. I shared stats. It's boring to sit in a room if you're not interested in health and talk about stats all day long. I understand that. And we also had Dr. Alvarado present stats on Tennessee, and then we had Danny call in to talk about blue zones. Now, one of the most important parts that came out of that meeting was our blue zone champion. And that is Miss Cindy Ogle. So she showed up. Wave your hand. Thanks, Cindy. I used to have a picture of Dolly up here just to joke, because when people would talk about Sevier County, they always think of Dolly Parton, and I say, well, this person's very well respected, a mover and a shaker, very influential. The champion is so important to the work in blue zones, because I might be your subject matter expert when it comes to health and public health and other things, but it really takes that influential person in your community. And Cindy I'll always be grateful for this, because she took a chance on someone that she didn't know at all. We met during COVID times, and I am an outsider. I'm a transplant, so that's really hard to kind of do that work. So Cindy was the one who got the people in the room, who got the people to show up to these meetings. She said, hey, I want to talk to you about blue zones. Emma, do your presentation. And we did, and it's really what got it going. And Cindy told me she met her match, and I didn't know what that meant. And now I do. And I try to be less persistent, but I'm very passionate about this, and I believe in this work. So I'm going to keep doing it. So Cindy, she can take some questions too, and she'll be here for a little bit, but Cindy's really the reason why Blue Zones got kicked off and started in Sevier County, despite the case of mentioninitis that I had every time I had an opportunity to talk about Blue Zones with people. So where are we in Sevier County? We're in the first phase. So we're in that feasibility and readiness assessment. This will take us about 9 months. We paused because of the hurricane. And this assessment is so important, because what we do a lot of times is, you've seen the CHAWs and the CHIPs, we create these plans, but it's pretty blanket to the whole community, right? We don't actually drill down. We do have census tract data, so not even just the zip code, we can get down to the street that you live on and tell you what your prevalence is for heart disease or diabetes, for example. But we're not really good at saying, all right, how do we take a step back and identify what's going to be the most feasible or viable? So this assessment is very important, because it's different than what we typically do. The other important part of this assessment is the funding for it. You have to pay to do this, and how do you get funding for that? And Sevier County chose, and I'm thankful for that too, to the mayor's office, to use a portion of their opioid abatement funds. And the reason why we did this was because there is one line that allows you to do primary prevention in schools, and that was what we did. So our focus area is going to be on the schools, but keep this in mind that we're not just focusing on the schools, we're using the schools as that center, and we're hoping to have that ripple effect where there's 32 schools. You're in Sevier County right now. There is a building in every community in Sevier County where there's schools. If we can start there and go out into the communities with the work that we're doing, we're hoping to see an impact. Now, I have the justification for why we use the abatement funds, and how we feel that if you incorporate a multifaceted approach to address SDOHs and use wellness as a model to prevent substance use disorder and address ACEs, we believe that we will see a decrease in these substances misuse and SUD. So I can share that with you. That's a different topic for a different day. But anyways, we're hoping to see that. And also with focusing on the school, not just because the funding dictated that that's how we had to spend the money, but this is our equity approach to this as well. This is getting folded into that, because what you'll see a lot of times in health and in schools, and I'm not dogging this at all, because it makes sense when you have limited resources, we'll buy one curriculum because the curriculum's expensive. We'll buy one evidence-based program and we'll roll it out to every school. That is not going to work anymore, because we can't do the same thing in Gatlinburg that we do in Kodak. So we need to identify what we're going to do, where we're going to focus, and what makes sense for that little pocket community to improve overall health outcomes for Sevier County. So it's those little bites that we're going to get to, what is it that saying, how do you eat an elephant? You take small bites. So that's what we're going to try to do. Oh, I think I broke this. Am I done? All right, the last thing I'm going to leave you with before I talk about our vision for Sevier is the E's. I have an environmental health and safety background. So my first job, I learned how to engineer workspaces and environments where the safe choice was the easy choice, but I had no idea how to change behavior. So I moved to Colorado, and I got a job thinking I was going to learn how to change health behaviors as their wellness program manager. And it was really back to the engineering again and the behavior piece. So when you want to make work sites safer, you want to prevent injury, the most effective thing that you can do is engineer the environment to where by default the safe choice is the easy choice. You take that behavior out of it and you engineer it to where somebody can't get hurt unless they try really hard to do it. Now with engineering, it takes a long time, it's expensive, it's not always feasible. I can't go into the national park and flatten out the trails and move all the rocks and trees. It's not feasible for me to do that to prevent that injury. The other E is enforcement. That's not really fun to do, but sometimes if somebody does go out of the way to get hurt or do a behavior, you can write tickets. You can tell people what to do. I don't really like that. But you can do that in a way of policy. You can make that more of a positive than a negative. And then the one tool that we use all the time in public health, it's a very effective tool, but it's education. We educate people on everything they need to do, but we don't make it easy for them to do it. And education's a good tool. It's something that's not as expensive, it's quick to turn around, and you can reach a lot of people, but education's not where you need to go. And then the last one is empower. I added this one. This isn't part of the safety model, but I have a PhD in leadership in health sciences, and I don't have a PhD in public health because I believe that there are leaders out in every community, and how do I teach those people to have those skills so that they can lead communities to improve health outcomes? It doesn't have to require a title. It doesn't have to require 4 degrees to do this. How do I get other people to do this? So that was the other part of this project. And I just want to go back to this education thing, and I want to talk about Dolly again. So are you familiar with the Imagination Library? Everybody familiar with that? Okay. Let me tell you what Dolly did. She's a genius anyways, but she is so smart. The Imagination Library, I don't know how they did this, so I'm making this up, but they didn't sit in a room and Dolly say, hey, we want people in Sevier County to have higher graduation rates. That's where it started. So we're going to put in more libraries. We're going to refer people to those libraries. Everything's going to be free. We might even give them cars to go to the libraries. They didn't do that. She didn't do that at all. She engineered this and made this easy for people to read and have access to books. They mail it to your house. They don't refer you to a place. They don't tell you this is where more libraries are. She mails it to your house. She was doing SDOH work and addressing SDOHs before we were even talking about it. So love Dolly for lots of reasons, but I tie this back. Why can't we do that with health? Why can't we do that with food? Why can't we do something very similar instead of referring our patients to these places and expecting them to be able to get there and have access to that? They don't. How do we do that? So what are we asking for in Sevier County? Well, in Sevier and Tennessee, it's going to be a paradigm shift to address these root causes. We have to build sustainable environments where people can make these choices themselves, but it's easier, it's by default. We don't rely on that behavior. And sustainable is the key part of that. It is a health problem, but it cannot be just health people who work on this, okay? It takes all of us. Those 40,000 people that I talked about in Sevier County and that $74 million, if public health and the hospital were the only 2 places working on that, we're never going to see a change. This is an us problem because those people live here, they work here, they go to school here. We've got to figure this out. We have to engineer our environments where by design, it's easier for them to have access to these healthy choices. And we have to have a holistic approach. We have to incorporate the essential components such as purpose and happiness and belonging. Talk a lot about exercise and physical activity. We talk a lot about nutrition. But this purpose and happiness and belonging deserve a spot just as high on the podium as these other ones because this has a great impact on our chronic conditions and it does not get enough attention. So I'm excited for Blue Zones to come in here and do this work, not only to where we can move better, we can eat better, but we can just feel better on a holistic level. Okay, I'm glad I'm done now. So I'm going to introduce our panelists. So we have Alan Newton, who's the Executive Director for Sevier County Economic Council. And we have John Matthews, who is the founder and CVO of JM Consulting. I gave him that title. Christy Lehman, she's one of our school nurses. And Christy and I would say Christy was my first friend during COVID because her and I talked the most, where I moved to a place where you can't make friends, and her and I worked together on COVID. So I'm very fond of Christy. And then Brian McCarter, who's our vice mayor, who agrees to give us money when we ask for it, or Cindy tells him. So very much. And then we have Kim Porter, who's with the Blue Zones, who was part of the Fort Worth project. So very grateful for you to be here. And I'm going to turn it over to the panelists.
You'll follow my lead? Okay. He is going to follow my lead. I hope that. I'm really grateful to be in this seat. I always tell people that truly my purpose and paycheck collide. I don't know how many people can actually say that. I had the distinct pleasure of working for Blue Zones Project Fort Worth straight out of the gate. So assessment, kind of where you are. Looking at all of your data, making sure that you're looking at benchmarks, but most importantly, you're looking at your strengths. What is going well? Where are the opportunities and where are the gaps? My charge, as Emma kind of talked about, was strategy. I do not believe that Blue Zones Project can work without a really strong strategy. So just imagine in this room, there are maps all over the place. We decided not to go with a community-wide kind of rollout, just because all communities do not operate the same, right? So we created what is called a neighborhood by neighborhood strategy. I literally took everything down to zip code level, trying to ensure that people saw themselves in the project, that we had really good champions. Some of you in this room are definitely champions. I met with the steering committee yesterday with Margaret Brown. You guys are amazing. You're excited. You have all the right questions. Blue Zones Project in Fort Worth was probably one of the hardest projects I've ever had to work on. You know why I say that? What do you think about when you think about Fort Worth? What comes to mind? It's big. What else? Beef. Yes, beef. This is a total mind shift. It's a behavior shift. And Fort Worth literally is not set up for wellness. It is not set up for well-being. We live in our cars. Everywhere we go, it takes us 50 minutes or an hour to get there. Nobody is putting feet on the ground. We went from 185th on that well-being index score that Danny talked about earlier to 58th. We eliminated smoking in public places. It decreased 30%. I honestly think if this can work in a place like Fort Worth that is large, conservative, right? Is all about meat and chicken fried steak, that I honestly think it could probably work just about anywhere, and I can talk all day about this project.
Thank you for that. So I promised I'd follow your lead, so I'm actually going to fall right in with, we also don't have just the healthiest options in Sevier County. I think our state or our local restaurants, Waffle House, or some kind of pancake place. If you go just drive 2 or 3 blocks, there's a pancake house. Another 2 blocks, pancake house, pancake house. So we have a unique opportunity here, and I don't know why Blue Zones didn't come to this Appalachian community long before they went somewhere else, because we only have about 100,000 people that live here, and we have this school system idea that we're going to try to re-educate our kids and really start young, because they have authority figures there. They have teachers, they have principals, they have school superintendents that care about them and want to show them a right way to live, in a healthy way to live. And so as those individuals grow up, hopefully Sevier County 5, 10, 15 years from now is going to benefit from that. But we also have 14 million people that come here every single year. They spend $4 billion in our town. And I don't know how many people go to the beach every year, and before you go to the beach, you want to get a tan, you might get a new bathing suit, you want to lose a little weight to go there. Well, how cool would it be if we created a community that we had bicycle paths and we had places to go other than, just sitting down and going on vacation. These are repeat family members that come for generations. And if we had the ability to show them other ways to have fun and get outdoors, the next time they want to come here, instead of going and getting a tan, they're like, you know what, I want to finish that hike I couldn't do. So I'm going to get healthier. And they go back home and they do that. So, we're a day's drive from so many different states in the eastern United States that, to me, it's Blue Zone's best bang for the buck. I mean, that one should just give this thing to us, I know we spent the $250,000, but what they're not saying is there's another thing, another component, which is like phase 2, which costs millions, right? And so I think all the community leaders are on board of doing this because we know firsthand after the Gatlinburg wildfires, in order to mitigate something so large, you need a team of people that wake up every single day, and the only thing they think about was, at the time, wildland fires and people that needed to get back into their lives because they were displaced. But Blue Zones, they're waking up Monday through Friday, 8 to 4:30, and the only thing they think of is Blue Zones. If you try to push this on somebody that is already busy, it's just going to fall to the wayside. That's the key component, in my opinion.
Sure. Yeah. So us in government leadership, we're not in public health. Okay. So when Emma talks about chips, I get hungry, that type of thing. So, all this is foreign to us, right? But the concept of, we know based on our culture, where we're at, I'm 10th generation Tennessean. My family originally from here. It's hard to change some of those background things. But the thing that really sold us on the Blue Zones was the variety. It's not just you need to eat healthy, which you do, but it's, hey, we heard this yesterday from Margaret, maybe at night you should sit down with your family and have a dinner. Maybe you should go play sports with your kids. Maybe you should pray with your family more often. And it was sort of that kind of shotgun approach, that it's not just one, it's several different things, that appealed to us in being that, we can actually sell that to our community way better than you need to eat healthy. I mean, how long, and like I said, I'm not a public health person, so I apologize. I apologize, Dr. M. I didn't know you were a doctor, by the way. So, but how long have we told people to eat healthy? A long time, right? And based on our data, is that fully working the way that it should? And I think we feel that the answer is no. So how do you reach people? How do you truly get people to want to get excited to make changes? And so that's what really appealed to us. When we started talking about using opioid funds, there's a lot of different ways you can address that. But this seems like it could address core aspects of maybe what's causing not only opioids, but a lot of different things. And so, from our standpoint, from a governmental standpoint, it was kind of a no-brainer, mostly because Cindy told us we had to do it, and so we had really no other choice. So my boss, Mayor Larry Waters, which I'm not sure if any of you folks know him, he's been the mayor here in Sevier County since Reconstruction after the Civil War. Now he was first elected in 1978. He's been mayor of our county since 1978, and so you would think someone that's been mayor for that long would not be open to different ideas, right? But actually he was, because there's a little bit of a understanding from us that doesn't necessarily get the public health thing fully, that we know we've got to do something different. We've got to do something that get folks on board, and then that can affect policy that we make. The county has never really forayed into public parks and recreation. The cities have, but the county hasn't. And Mayor Waters said, maybe it's time. And maybe this can be a component of that, and we can roll all this together. So we're pretty excited about this. And then for us, it's also return on investment, and Alan can talk a little bit about that. And then it's also about the kids. I've got 2 kids in school. Well, I don't know if they've been to school at all in January. They've been out. So we're going skiing next week. So, of course, when it warms up, they're going to be out. So they don't even know what school is anymore. I've got 2 kids, and it's a reminder that, hey, we need to do a better job. And so I'm sitting here saying, if it's pricking me a little bit, then I need to make changes. I'm pretty excited to see what it's going to do community-wide when we get so many people on board. And the other thing I'll just mention real quick, and I'll turn this over to somebody else, is collaboration. Sevier County is unique, I believe, in the state and probably across a lot of the country, in that, for the most part, our elected officials, city leaders, our leaders of our hospital, the health department, across the state, we all actually not only get along, but we genuinely like each other. We don't necessarily agree on everything, and everyone's got their own little bucket that they're taking care of, but we can actually all work together to come up with a solution. And so I would think that if you're in a fragmented community, that one of the first things you'd have to work on before undertaking a project of this size is you're going to have to build those relationships. Lucky for us, we pretty much already have them there. But that's another thing I think that you have to keep in mind when going through this. But from a governmental standpoint, we're pretty excited, which is unusual because government's horribly boring. And that's coming from a guy that came from public accounting. So, but we're really excited about this and interested to see where it goes. And being an accountant, I like data. So being able to see our data here and then actually having results that we can show people that it's working. And if it's not, let's back up and punt, I think is pretty key too. But the return on investment is huge too, wouldn't you say, Alan?
Yeah. So, Sevier, a lot of people don't understand Sevier County's economy, right? I mean, we're a population of 98,000 people. And of that 98,000, around 50,000 are in the workforce. And if you look around at all of the businesses and, how many communities do you know that has 3 250,000 square foot convention centers, right? That has a Target, has Walmart, has all of this kind of stuff, has thousands of cabins. We have beautiful facilities like this, 98,000 people. So from the health perspective, and again, I own restaurants, so my hot fudge cake has eggs and milk. We have egg and milk in our hot fudge cake, so if you want to go eat with us, But if you think about the number of employees that it takes to run all of these businesses, we have to attract employees from a 9-county region to come in and fill all the jobs, and we still don't have enough people to fill those jobs. Well, if those people are sick, they don't come in, they have call-outs, they don't come into work, they don't have good health, that costs us millions and millions of dollars. And we're always looking for ways to improve our citizens' health so that they don't get sick. Well, we always hear, let's have an exercise program, let's do this, do this. We've got to get our business owners are a huge part of the success of something like this. Because if we can get them bought in to helping us promote good health to their employees, and a lot of these places have wellness programs, they're big guns in January, aren't they? I mean, they're all at the fitness centers, they're all eating right, and then as my son would say, if you'll just wait till about the middle of February, it won't be crowded at all, right? So we've got to change behaviors, and we've got to change behaviors of our employees. And so we just felt like that we could get our businesses involved if we could show them the return on investment. And a lot of those numbers, Brian and I, we're not in your environment a lot. We don't understand all this kind of stuff. But Emma, she's probably Dr. Emma, is probably one of the greatest salespeople that we've had, is that she got on this and kept on us about, we need to do this. And when Cindy got involved, we knew we were in trouble and that we were going to have to do this. But once we got into it and started understanding what this all looks like, what a great investment for our community to make in trying to get with our school system, and our school system folks are here. But not only, if we could get it started there, hopefully we can spin it out to help our employees to be more healthy so that they'll show up for work. I mean, when you show up for work and you're got 7 employees that call out and you have a total of 30 employees, that is a big deal. That is a big deal. So the healthy, the more things that we can do to promote better health, better behaviors is really where we need to be involved in. And we're just now getting into it. We're looking forward to the assessment so that we can figure out exactly what we need to do and what area. We're not going to be able to tackle all the areas, initially. We're going to have to pick out some. And we think the school system, our kids, is going to be the number one thing that we're going to start with. And so we're really looking forward to seeing what that assessment's got to say.
And I guess I'll go last. My name's Christy Lehman, and I'm with the school system, and I'm I'm the lead nurse. Just a little bit of information about the school system. We have about 14,000 students in the county. Within that, we have 32 schools, and we have 30 clinics, and so clinics that are run by a nurse in those schools. So that kind of gives you a demographic. We do have in our communities, we talk about our Northview, Kodak communities, but we have a school in each community. So my passion is number one, I have the best job in the whole wide world. I am passionate about kids, passionate about health care. But we, in our clinics, we see the end result. We see those health outcomes that, kids that have type 2 diabetes now, kids that have high blood pressure. But all these trends that you're talking about, the midlife crisis when kids are turning 18, mental health is it's skyrocketed. Our kids have depression, anxiety, all these things that are on them now that we didn't have before. So not only are we the nurses that you traditionally are taking care of your type 1 diabetics and your tube feedings and things like that in the school system, but we're also seeing all this mental health coming into the clinic as well. So it's been a challenge for our school system to meet those mental health needs, and looking at resources to hire counselors and hire people to actually address those needs. So when we see this outcome coming in, I feel thankful that, I fall under what's called coordinated school health. I think we'll learn a little bit more about that from another speaker. But with the state of Tennessee has what's called coordinated school health with the Tennessee Department of Ed. And so nursing falls under that. Coordinated school health is 8 components that are made up of all the things that we talked about: family engagement, physical exercise, nutrition. So those things that we talk about, what makes up a blue zone community and things like that, we're doing that already, but how do we get our community involved? How do we get these outlying communities? We have several schools that have Steve, I think pre-K through 6 now. We have a couple of schools that pre-K in the far ends of the community, kind of like yours. You have all this vast thing that one school has less than 200 kids. But then you have a school that has 1,500 kids in our city schools. So you have to go out to the community to see where we can meet them. We already know that, but how do you get it all in a ball and a plan that everybody's on board? You can do all good things in little areas, but it reaches out everywhere. And then when you think about our kids, all this starts at home. These behaviors and things are learned at home. Us, as employers, where do we spend most of our time? At work. Where do kids spend most of their time? So we got to reach them. We got to reach them because we don't want them to have not undealt with anxiety and depression. That leads on to all the health problems. So if we don't catch this early, if we don't start in the schools, then where are we going to start? Because then we're going to be chasing all those diagnoses in the end, and we never can change that curve. And the way we're doing it now, if you look at our statistics, and I'm not a statistic person, I'm not a money person, a government person. When they ask me to come up here, I'm like, I'm just a nurse. I just manage the nurses. But when you see all that, and you see that you have that one kid that walked in, that you saw something in them, that you changed, that you did something, you got them that access that they needed, and that kid flourished, or that kid graduated, and now you see that student in a community that's thriving and doing well, that changes you. So, I feel like that for us, that this is important work, and we want our kids to stay in Sevier County. We want them to work in Sevier County. We want them to be a productive member of our society, but we want them to be healthy and live to 100 in a blue zone.
Another thing about the schools, I'm going to turn the questions over to y'all, is we know that you can't just teach students how to do this. You've got to reach the families, the parents, the caregivers. So we're failing when we just talk to just the students and say this is what healthy looks like with my plate. You've got to reach the whole community where they are. So now I'm going to turn it over to y'all. I had questions, but they did a really good job of explaining their why, so I don't have any more questions. So what are the questions from the audience?
Yes, we do have telehealth set up, and that's for student and staff. And we started that in 2008, and so all of our clinics, except on one school system that is like under pre-K age, and we just feel like that telehealth is not appropriate for that age. They need hands-on for that age group. But good question.
Emma, we're wondering, Chrissy, are you all keeping stats on how your graduation rate may rise based on the fact that you are starting early and you're educating kids and you're hoping to reverse those SDOH trends? That, in effect, should increase the graduation rate. Are you all following those stats? Is that something you're thinking about?
Absolutely. And, through coordinated school health as well, not on a state level, we collect all kinds of data, BMI data, blood pressure data, other data as well, but definitely graduation rates for sure, because, that's the good end result of that.
I want to say, too, I love all of your passion. I love what you said about being able to change that one person. Everybody in this room is here because we've organically grown this because we've seen one person change it.
I heard a story yesterday, and it was about a child that was actually seen through a telehealth visit. And I will try not to cry. I promise myself I wasn't going to cry today. But this child just shared one thing with this one person, and that went on to change their whole trajectory. And, if we don't have these interactions, and this openness, it could change a person's life, forever. So you got to find your purpose.
I have a question because they talked about pancakes. So whoever wants to take this one, John or Brian or Alan. So when you come in here, you see all these restaurants and pancake houses. How do you envision blue zones with what we already have, our current infrastructure, and how we're going to keep growing and progressing? Don't fight
That's
over
what we're paying
this.
$250,000 for. They're going to tell us what we're going to do. That's what consulting's all about. I guess, my favorite saying is nothing changes if nothing changes, and if we sit here and just like Brian said, and I think Dr. Mayberry said on his slide, we hear about all these things, but nobody ever wants to change. We know that health and fitness is important. We know that community is important, but nobody ever wants to make that shift. And I think I know I live here and I get to see it firsthand because these are all my friends, but truly the community leaders here, they meet once a week. I know you can see all over the media, sometimes you've got city mayors, county mayors, just, pointing fingers. It's their fault. Not here. They meet monthly. They sit and break bread together. They talk about how can we make Sevier County a better place. And so it takes that mindset to change things. And we might not see results next year in 2026, but if we don't start now doing something, in 2030, we're still going to be in the same place. So you're not going to have a different year. You're just going to have another year, essentially.
So I think to John's point, as Alan is a restaurant owner, it's really all his fault. So, but and I'm just kidding. So, but like in our meeting yesterday, we had Elise Collier-Massey, who is over Collier Food Group, and they own multiple restaurants here in Sevier County. And people are still going to come here for the pancake houses, right? And I think that if that's the only reason they're coming here, now that's maybe there is that niche kind of market, but they come here, they enjoy going to the pancake pantry, they enjoy going to these traditional places. there's going to be room for that. But I think one thing that got talked about yesterday was, maybe just make a goal to put one vegetable on your plate. Have that option there. And I think if we get those folks on board, that they can offer those different, alternatives, that, you are making that a little bit easier for those folks that are coming here, and also for us locals that are involved in that. Like I said, that's going to be there. It seemed like our conversations we've had over the last several months and the last several weeks, and even yesterday, it kind of goes back to a good biblical term, right? Moderation. And so being able to show that and get our folks on board to be able to provide that option, I think is going to be key. Are we going to win everybody? No. But if you're getting some of them on board to at least offer that option, and then you make it easier for those folks, I think you're going to have better success. Tourism is our lifeblood here in Sevier County. We do have some industry. We've worked pretty hard on that. But tourism is huge for us. And, as John said, as Alan has said, on any given night here in Sevier County, there's 100,000 residents. But there could be well over 250,000 additional people, okay? In the county, outside the cities, of that number, there's about 100. There could be on any given night 130-something thousand outside of the cities. So it's a unique dynamic that we have to work through, and I think, as Alan said, getting those businesses on board is pretty key.
Well, as a restaurant owner, one of the things that we have talked about as it relates to blue zones is I may be talking about you, and if I'm talking about you, I apologize. Have you ever been to a restaurant where you have a mom and dad sitting there? They've got 3 kids. The mom and dad are staring at their phones, and the kids are trying to talk to them. They're trying to eat, and the parents are not paying any attention to the kids. You ever seen that? We see it all the time in our restaurant. Behavioral kind of stuff, mental health kind of things that are included in Blue Zone. That's something easy that restaurants can do. We were talking about maybe some kind of basket kind of that we could put on our table. It says, hey, put your phone in here and visit with your friends, visit with your family, at dinner time, because you can have dinner time in a restaurant just as good as you can have home. And, we offer green beans, by the way. I want to defend what we offer. But that's something easy for restaurants to start participating in. And again, you got to build that momentum. And you've got to educate, and you've got to see results. Return on investment, that's what you got to see.
And I'll say that too. So, we had talked about that, like can you get restaurants on board to encourage folks to put their phone down? We've talked about that multiple times. And for us, we advertise ourselves as a family-friendly destination for people. That to us was a great idea to even advertise further that family friendliness aspect of what we do. I had a good friend of mine, and I haven't invited him to lunch in a while because of this. I'm just kidding. But we used to have this rule where we would sit down and talk, and he would require us, we'd put our phones down on the table, and he'd say, first one to pick your phone up has to pay for lunch. So that's a lot of pressure. But it's those little things like that really sold us on the overall Blue Zone concept, that this is not just eat healthy. This is eat healthy, exercise. You've got to have friends. You've got to have this time to rest and decompress, and you've got to have spiritual time as well.
One last comment, then we're done, I promise.
I just wanted to piggyback that it's so much more, right? There are a couple things that stood out for me when I took this job. I've always been in community development and health, probably 25 years. Policy. If you want to change not just what you do for today, but for generations, policy is your bang for your buck. If you think about it, when I moved to Texas 10 years ago, people were still smoking in bars. That is no longer. We have completely changed the landscape, right? If you look at elevating conversations, there are things that sat that never came to be until Blue Zones Project was involved. One was safe routes to school. $6.2 million were poured back into the community in marginalized communities where kids could not cross the street to go to school. So there are definite benefits to this project that are not just about weight loss, but they are truly about communities coming together, joining a movement. We had over 88,000 individuals that participated in our project. At times it felt like we could not. You can ask Margaret. Like, there were times I was like, there's no strategy that can bring that many people together. And 10 years later, I still see people with Blue Zones t-shirts on. When I tell you this is probably one of the most transformational projects, and that's part of my title, transformational projects I've ever worked on, I am truly saying that from a place of knowing, because I was boots on the ground. I am a person who has done this work. So I'm extremely excited for this opportunity. I can feel the energy, but just understand that this is so much more than just people losing weight. And we're not the food police, but this is truly about connection. And this is about people wanting to live longer, healthier, better.
All right, y'all, I just want to make one last comment. I would win the phone game because I am super competitive and I would not touch my phone. So I'll be getting free lunch all the time, anytime. So thank All right, y'all. Thank you, Sevier County panel, and for you, Kim, for joining us from Fort Worth. I like to volunteer people, so if you have questions, they were selected to come up here because they represent different industries and work sites and serve different populations. So if you have questions and you really want to talk to them, they're available to you, so just let me know and I'll connect you. But thank you so much for being up here, and thank y'all for letting us have this time.